my name is Adriana English. I'm okay, I can call myself.
Yeah.
Hi, my name is Adriana English. I'm going to be your physician assistant student today. The purpose of this exam is to take your chest and cardiovascular assessment. So I'm going to go wash my hands, and I want you to please remove your shirt, shoes, and socks for me. And then we can go ahead and get started. Alright, so first I'm noting and assessing your rate, rhythm, and depth and effort of your respirations, and also looking for any signs of respiratory distress or any accessory muscle use. Also assessing your chest configuration, making sure that your anterior posterior diameter is about half of your transverse diameter, about 1 to 2. Right, now I'm now going to first have you turn it this way, and I'm going to palpate and look at your back. If you can move your hair for me. I'm now going to palpate your posterior and lateral chest walls, noting for any deformities or any tenderness. You're good there. And now I'm going to assess your thoracic expansion for respiratory effort and symmetry. Breathe in for me and out. Perfect. Right, now I'm going to palpate for tactile femidus, noting vibrations bilaterally. Okay, so when I have my hands on your back, I want you to say 99 for me, okay? Nice and slow.
99, 99, 99, 99.
Perfect. And now I'm going to percuss your posterior and lateral chest walls, noting any resonance or dullness. Okay. Perfect. And now that we have percuss, I'm now going to auscultate in the same exact spots, noting any bronchi, wheezes, or whales during one full inhalation and exhalation cycle. Okay, so when you feel my stethoscope go onto your skin, I want you to take one deep breath in and out for me, okay?
Mm-hmm.
In. Perfect. Sorry, you could probably be so out of breath. Okay, so now that we have done your posterior chest wall, we're going to turn back around, and I'm going to do your anterior chest wall. I'm going to have you lay down for me, making sure that it's at 30 degrees. I'm going to lift this for you. All right. So first and foremost, I am going to palpate your anterior and lateral chest walls, noting for any tenderness or deformities. Good there. Noting for thoracic expansion, for symmetry of respiratory effort. Breathe in for me, and out. Perfect. And now that we've done that, I'm going to palpate for tactile femidus, noting the vibrations bilaterally. Just going to say 99 again when you feel my hands.
99, 99, 99.
Perfect. So now we've done that, I'm going to do, I'm going to percuss your anterior chest wall, noting any resonance or dullness bilaterally. Perfect. Now that we've done that, I'm now going to auscultate in the same spots as I did percussion, and I want you to just take a deep breath in and out for one full inhalation, exhalation. Okay?
Mm-hmm.
Turn your head that way. This way. Perfect. Vesicular sounds. Vesicular sounds noted. Okay, so now that we have done your anterior chest wall, we're now going to move on to your cardiovascular exam. So first, I'm going to get my pen light because that would be useful, and look for her. Look at her jugular veins, inspecting for any distension or any pulsations. You can first look that way for me. All right, and now this way. All right, and I'm also looking over her precordium, noting for any abnormal chest movement or abnormal movement and her apical impulse. Okay, and then point of maximal impulse, and then we're now going to move on to auscultating her her carotid arteries with the bell of my stethoscope, noting any bruits. So first, once you feel my stethoscope go on, I want you to take a deep breath in and just hold it, and then I'll let you go, okay? Breathe in, hold, out. Good. Now this way. Breathe in, out. Good. Right, and now that we have done that, I'm now going to palpate your carotid arteries, noting rate, rhythm, and amplitude bilaterally. Now that we have done that, I'm now going to palpate her precordium in 5 different spots, noting any lifts, heaves, or thrills. Mm-hmm. Okay, so first we're going to do aortic, pulmonic, tricuspid, and mitral. And I'm going to now locate her point of maximal impulse, which would be mid-clavicular line in the 5th intercostal space, using 4 fingers, 3, 2, and then 1. It's noted as a light tap. All right, and now we're going to move on to auscultating in those same 5 spots, noting S1, the intensity of S1 and S2, while also palpating her carotid arteries at the same time to differentiate in between the 2. And then I'm also going to listen for S3 and S4, any murmurs, rubs, or gallops. Okay. But first and foremost, we're going to do aortic, pulmonic, herbs, tricuspid, and then mitral. All right, and now I'm going to use the bell of my stethoscope and go back up in the same 5 spots, noting for any bruise. Is it bruise or just no? No, I don't think so. So mitral, tricuspid, herbs, aortic, pulmonic. Is it aortic, pulmonic? Oh my god. Okay. Anyways, I'll fix that. It's okay. Okay. And then now, moving forward, we are going to now locate and assess your periphery. So I'm gonna just have you sit up now, just for a sec. And then I'm going to look at your peripheries, looking for your upper extremities, looking for any edema, any pallor, or any sort of cyanosis. So I'm going to see and check your capillary refill, noting that your cap refill is about less than 2 seconds. All right, cool. And now I'm going to palpate your epitrochlear lymph nodes, noting for any enlargement or any tenderness. So just this bilaterally. Perfect. And now I'm going to palpate your your inguinal. Yeah, so you can lay back down.
Okay.
Yeah. Your inguinal lymph nodes, noting any enlargement or tenderness there. And I would do this under clothing. Okay. So now that we have done that, I'm now going to look at your posterior extremities, looking for any cyanosis, pallor, or any edema, looking for your cap refill, making sure that it is less than 2 seconds. Now I'm going to go and test your artery or your pulses, starting with your lower extremities, rate rhythm and amplitude bilaterally. So first and foremost, we're going to do your posterior tibialis, your dorsalis pedis. All right, and I'm going to go wash my hands, and then we'll finish the rest of the exam. Okay. And then, so now I'm going to palpate your brachial. Relax. All right. Bend. Yeah, like that. All right. And now I'm going to do your radial bilaterally. Your femoral. Do this under clothing. And now your popliteal, one at a time. Okay, yes leg. It's up for me. Okay, now that we have finished that, we are now moving on to auscultating your arteries, including your, for any breweries, with the bell of my stethoscope. I'm now going to do your abdominal aorta, so if you could pull down your pants for me. Cool. All right, renal. Your inguinal. Femoral.
Mm-hmm.
Okay. And now I'm going to measure your abdominal aorta, making sure that it is less than 3 centimeters. So I'm gonna get on in there. Cool. Done. I messed up, but it's fine.